Hello, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I would like to compare anesthesia versus critical care medicine as a career choice, because many of you are actually confused whether to stay in anesthesia as a career and doing super specialties like cardiac, neuro, pediatric, pain management, and labor and regional anesthesia and other things, or totally venture into intensive care medicine and practice critical care as a separate specialty, because now what will happen in future is both will be separate. In metros it is already happening, in tier 2 tier 3 also that will start as a trend in future. You can only do one, and in that way you actually become expert in that area. So in this particular presentation I would tell you the required mindset that you require to practice both, because both require two different mindsets. Okay, and then best colleges to study, and I would tell you about the starting salaries, and because the salaries after 5 to 10 years down the practice totally depends upon multiple factors which I am going to tell you, and then work-life balance in both the specialities and abroad opportunities also I would like to focus in this particular presentation. Okay, first let me start with the mindset. So the mindset that is required to practice anesthesia and critical care are different. Why, I'll tell you. So if you are a kind of person who want to be known in a particular organization, you want everyone to know you, you want to actually interact with multiple people, little extroverted characterization is there, then I will recommend you to go into intensive care medicine. Because in anesthesia what happens is, if you are an introverted person, if you're minding your own business, and then if you want to actually give a kind of focus on one patient and deliver a good result to that particular person, then anesthesia would be a better option. So but by default what happens is, over a period of time in the organization many people wouldn't be knowing you, but as an intensive care medicine you will have better exposure to people. So that is what you need to decide first, because once you enter, what happens is, I still find many anesthesiologists actually feeling that many people wouldn't be knowing us even though we do good work. That is the kind of feeling they will be having. So that is that you cannot change, because that is how anesthesia is. You have to understand that and enter. In critical care medicine it is opposite. The moment you start your practice, within 1-2 months all the hospital will know, because everyone wants to keep their patient in your intensive care unit in a bigger hospitals, and that is how it is done. The same thing applies to emergency medicine also. And the next mindset thing is being calm under pressure. Okay, this is a very important thing I would like to highlight. So as an anesthesiologist you have to be very calm under pressure, because multiple times you would be tested on how you actually respond in pressure. Okay, there will be hypotension, there will be arrhythmias, there will be massive blood loss, and all the times you shouldn't panic and you should deal it with ease. For that, what I recommend is to get exposed to multiple situations in your PG life only, or go through simulations. Okay, that is the best way. That's a separate topic, we'll discuss later. In this video we'll focus only on the comparison part. So calm under pressure is much needed in anesthesia than in intensive care. So in critical care what you require is the interpersonal skills. Okay, interpersonal skills is what I actually mean is how you actually interact with other specialties, how you actually counsel the patient relatives, how you actually deal your leadership skills, and how you actually manage the intensive care staff. All these things are very important in critical care. In anesthesia what happens is, you manage one OT. So if you actually have a good relation with your technician, that is enough. But in intensive care you have to manage the whole intensive care unit. There will be nurses, there will be ground level staff, and so many other people will be involved in the care. So you need to have leadership there. Okay, without leadership you cannot enter the intensive care medicine. And the next is analytical thinking. Analytical thinking is required in anesthesia, but it's much more required in intensive care medicine, because if there is a kind of thrombocytopenia, then you need to understand what is the actual cause for that, what is triggering that, is there anything like that. Everything needs some kind of analysis that requires knowledge, that requires active research, and then you come to some kind of a conclusions after that. So in anesthesia what I observed is, every day you don't have to think so much analytical, because initially you might have to think, but after 4 to 7 to 8 years of experience it will be more of a repetitive thing. So consistent delivery of the services is the most important thing. That is, so to summarize the mindset that is required, the most important thing is, if you want to be known in a particular organization or a setup or a hospital, and if you're an extroverted person, go into intensive care medicine. If you are a quality oriented person, if you want to if you're a little introverted person and if you want to stay with one patient, then go into anesthesia. But many seniors wouldn't agree with what I told. You will claim that anesthesia also requires leadership, anesthesia also needs kind of counseling and kind of collaboration and kind of talking to different patients and everything. I totally understand what you're telling, but just to compare, to understand, this is what it's my personal feeling. But anesthesia also requires all those skills if you want to excel in that. But even without that, you can actually survive there. But to survive in intensive care, these are the basic things which are required. So let us next go into best colleges to study. For anesthesia, AIIMS New Delhi is the best, CMC Vellore, AFMC Pune, PGI Chandigarh, Maulana Azad New Delhi, JIPMER, Kasturba Medical College Manipal, KGMU Lucknow, St. John's Medical College Bangalore, Sri Ramchandra Chennai. For intensive care, if you think about DM, AIIMS DM is there, PGI DM, CMC, JIPMER, AFMC, KGMU, Tata Memorial Hospital, and IMHANS if you want to do neuro-intensive care, not a general intensive care, that is the best place. Sri Ramchandra and Mahir. Almost it's a repetition, I can understand, but the thing is they are the best in both the specialities. Okay, let us go to the interesting part, that is the starting salaries. Why I told starting salary is, I told in previous videos also, only starting can be decided by somebody. After that, how you grow as a doctor totally depends upon how you are actually delivering the services, what kind of value you are adding in a particular organization. It's not the number of years or degrees that you have. The starting salary is the only thing which is fixed in anesthesia and intensive care. I have seen many anesthesiologists and intensive care specialists who started small. Over a period of time, they grew in different directions. I have seen one critical care specialist, taking very high salary with the same experience. Another intensive care specialist is stuck in some area. So that depends on your leadership skills. That also depends upon the way you actually, project yourself, the kind of quality service you are giving. If an anesthesiologist, it's all about the skills and the consistent delivery of the services without major complications. So all these things will matter, and this level of skill development will vary between people because everyone is not the same. That is what I understood. Some people actually try to relax after a certain age and they take a plateau or a dip, but some people are more ambitious. Even at the age of 45, 50 also, they're keen to learn and they grow. So their salary would be more than a person who is relaxed. Okay, so the starting salary is pretty fixed in even you're a topper or gold medalist or whatever, starting salary is the same. And anesthesia, typically what I'm saying is MD anesthesia, if you do in any big city, you get around 1 lakh salary. Okay, and in tier 2 cities, you will get around 1.5 lakh salary. In intensive care also pretty much same, but slightly higher than anesthesia, around 1.2 to 1.3 lakhs is the starting salary in bigger cities. And for registrars, and if you are a DM candidate, the game is different. DMs will almost get near to 2.3 to 2.5 lakhs in bigger cities and tier 2 places also. Tier 2, tier 3 wouldn't require DMs, they will require fellowship in intensive care people. So they would give around 1.4 to 1.5 lakhs. So this is how intensive care person would be paid. Slightly more than anesthesia, I can understand, because there is element of risk also associated with the practice. Okay, that is what and some element of revenue also would be looked at by the management when they're seeing. Okay, so that is about the practice. But as you grow, what I'm saying is anesthesia people are earning more than the intensive care people. That is because anesthesia guys would be paid more, a case based or some kind of a pool or something would be there. So what happens is by default they get some element of cut in the surgeon's package. So their salaries are actually more. When you become more experienced as anesthesiologist, you might earn more than an intensivist, but the starting salary of the intensivist would be more. Okay, if you have patience, then stay in anesthesia. If you want to earn more from beginning, go into intensive care. I think the first plan is a better plan. Work-life balance, if I have to talk about, anesthesiologist will have a scheduled working day, but sometimes it will extend. You have to be ready for that. For example, if you start a case at around 2:30 or 3 o'clock, you might think it is a 1 hour case, but sometimes it might extend, right? It might go up to 6 o'clock, 7 o'clock. But as a whole, if we have to discuss, anesthesiologists will have a pretty decent work timings compared to surgeons, orthopedicians, and other contemporaries. Okay, intensive care is a shift based. It is never based on the cases. So you come in one time, you'll go in one time. That is pretty fixed, but the shift can vary. So you can have night shifts, you can have morning shifts. So you might have a 8-hour shifts or a 12-hour shift based on your organization. So you come in one time, go in one time. It is also pretty shift based. So once your shift is over, you'll not be disturbed. So even intensive care will have a pretty good work-life balance. So both work-life balance wise, if I have to compare, I think if I have to if you ask me, both are almost same, but anesthesia will have a better work-life balance than intensive care. If you dissect, in detail and see, but as a whole, if you ask me, both have pretty much, almost same work-life balance. Abroad opportunities, most of you are interested in knowing. USA, Canada, Germany, Middle East, many countries actually want anesthesia and intensive care specialists. So, most of my videos I already told you, with surgical specialties, it's very tough to go to other countries. in clinical specialties, preclinical specialties, and anesthesia intensive care, it's very easy. So anesthesia intensive care's main advantage is that you can go and settle in any country because you don't require a patient base. Okay, so Middle East country, both specialties are required, but when I look at the numbers and statistics, what I understand is intensive care specialty has more chances than anesthesia. But at the same time, anesthesia is no less than intensive care. It also is required. But overall, ICU will have a more easy entry into Middle Eastern countries. USA, if you ask me, there is demand now, and there is a demand mainly in the peripheral locations, and some area there is a need. USA and Australia, they are called as area of need vacancies. A lot of area of need vacancies would come. Again, there compared to anesthesia, intensive care will have a better vacancy because many hospitals and many over the globe will have ICUs, and that needs to be manned 24 hours, right? So they don't have enough people in other countries to man ICUs. So as intensivist, you will have a better opportunity to settle in other countries. And even UK, if you want to go as an intensivist, it is pretty much easier than going as an anesthesiologist. Okay, hope you are understanding. So here, critical care will score more than anesthesia if you are planning for a broad opportunity. But overall, again, this is a micro dissection and going into detail and telling that critical care is better than anesthesia. But compared to any other branch, if you ask me, both specialties are considered having better abroad opportunities. Okay, I'm not telling that anesthesia has a lesser opportunity. Compared to critical care, anesthesia has a lesser opportunity in settling abroad because of the high demand for critical care services in all the countries. So to conclude, what I recommend you to do is, you think what your mindset is, you think what your financial goals are, you think where you want to settle, and then take a call. So that is the best thing. That is why I dissected before taking a decision. These are the headings I would think in my mind, and I put across everything to you. Now you are the one who needs to take a call on which area to go, but don't club both and try to practice both. Try to go to one area. That is how future is going to be. So I'm in neuroanesthesiology, and only neuroanesthesiology is what I do, and neurointensive care I practice. So I be in both the zones, right? So I understand there is a different mindset required in both the areas. So you try to be in one niche, either be in intensive care if you or be in anesthesia. If you are in anesthesia, you do general anesthesia, but try to actually master one area. That would actually help you in growing faster in your career. Okay, and thank you very much for following the video till now. Hope you got your answer, and please subscribe to the channel because many people are watching and not subscribing to the channel. If you come till here, I think you should subscribe to the channel and share the video. Even though you don't share, at least subscribe to the channel. Okay, thank you very much. Thank you all. As usual, Dr. Dheeraj Masapu logging off.